Tuberculosis is a contagious and potentially serious infectious disease caused primarily by the bacterium Mycobacterium tuberculosis. It mainly affects the lungs but can also impact other parts of the body. The causative agent of tuberculosis is Mycobacterium tuberculosis. Other related species are the Mycobacterium bovis from cattle, the Mycobacterium africanum, the Mycobacterium microti. Types of tuberculosis. Pulmonary tuberculosis. It affects the lungs, most common, and it's contagious. Extrapulmonary tuberculosis. It affects other parts like lymph nodes, kidneys, spine, brain. Latent tuberculosis is inactive infection with no symptoms and it's not contagious. Active tuberculosis is symptomatic and infectious and it requires immediate treatment. Mode of transmission. It's an airborne transmission through droplets released when an infected person coughs, sneezes, or speaks. Prolonged exposure in poorly ventilated areas increases risk. Pathogenesis. Inhaled bacteria reaches the alveoli of lungs, engulfed by macrophages. Bacteria can survive and replicate inside macrophages, form granulomas. In latent TB, bacteria remain dormant. In active TB, immune system fails to contain bacteria. Symptoms of active tuberculosis: persistent cough, which can last 2 to 3 weeks, chest pain, coughing up blood or sputum, fatigue and weakness, fever and night sweats, weight loss and appetite loss. Diagnosis: tuberculin skin test, mantle test, interferon gamma release assays, chest X-ray and sputum smear microscopy, culture test and molecular diagnostics. Example: GeneXpert, MTB or RIF. Treatment. Standard treatment involves a 6-month antibiotic regimen. First-line drugs: isoniazid, rifampicin, ethambutol, pyrazinamide. Drug-resistant TB requires second-line drugs and longer treatment. Prevention and control: Bacillus calmette-guerin vaccine, especially for infants. Prompt identification and isolation of active TB cases, ensuring treatment adherence through direct observed therapy (DOT). Screening high-risk populations, example HIV-positive individuals, healthcare workers. TB in animals. Zoonotic TB, caused by Mycobacterium bovis, affecting cattle, deer, badgers, and can be transmitted to humans. Control includes cattle testing, pasteurization of milk, and animal culling. TB is one of the top 10 causes of death worldwide. HIV co-infection increases TB risk. TB is preventable and curable. Early detection and adherence to full treatment are essential. Global health priority due to infectious nature and drug resistance.